Now, the Global Cancer Awareness Day celebrations were held in Nyeri County with the key theme, We Can, I Can, signaling a collective involvement in the fight against cancer. Dr. Jackson Kioko, the acting director in charge of medical services, was the chief guest, accompanied by other key officials from the health sector, both from the public and private sectors. Many people continue to suffer once afflicted by cancer, as the cost of treatment is prohibitive to many, as well as many hospitals offering cancer treatment and management being inaccessible to the larger population. Many often have to travel to Nairobi to seek services such as radiotherapy. KTN's senior reporter Carol Nyeri attended the event and brings us the following story.
Cancer screening and early detection was a theme of an awareness campaign carried out at the Kenyatta National Hospital as Kenyans commemorated the 16th World Cancer Day. Free screening for various cancers for the general public was offered, done by doctors and other health professionals drawn from the National Referral Hospital.
Mostly you have a lot of, there's a lot of cervical cancer and breast cancer, and lately there's been a lot of esophagus cancer, which sometimes also end up like a stomach cancer.
Normally I've been going for cervical tests and breast tests, but I never thought that there would be over 100 types of cancer.
They say if it is arrested early, it can be cured, and the earlier the better. I would advise everybody to take it.
Kevin Washiro is a cancer patient, and although the journey has been tough, he is grateful for early detection.
I was feeling fine. I'd gone for a checkup and the doctor saw something that didn't seem right. I was diagnosed with multiple myeloma last year, which is cancer that affects the blood plasma.
Statistics from Kenya's Ministry of Health show that there are 27,000 cancer-related deaths and 40,000 new diagnoses annually. Half of those diagnosed with cancer die before getting treatment due to the late detection of cancerous cells. The low rates of testing for both men and women mean that detecting cancer early when the disease is most easily cured is less likely.
The main thing is to be cancer awareness so that at least this thing can be, they can be detected early. And also the treatment can be started early rather than waiting for a long time, and then by the time you come it's too late.
The high cost of treating cancer has remained a challenge to many victims. The good news, however, is that contributors to the National Hospital Health Insurance Fund, NHIF, will soon get outpatient cover for chronic diseases such as cancer, HIV and kidney diseases. Under the new NHIF package, patients in need of chemotherapy will get a cover of 25,000 shillings per session, while those getting radiotherapy treatment will have a cover of 18,000 shillings per session. Monthly clinic checkup for patients with cancer and other non-communicable diseases will get a cover of 5,000 shillings. The services are available in the 1,400 health facilities that are working closely with NHIF across the country and whose capacity to offer the services has been accredited.
As for the chronic diseases, we pay them separately as fee for service. Our member, where we suffer from cancer, you identify the facility and we'll be able to take care of that. So we have taken it out of the normal care, and this has been a great pleasure to Kenyans.
The good news doesn't end there. Reports indicate that Kenyans spend at least 10 billion shillings every year to seek cancer treatment abroad, mainly due to lack of specialized equipment and facilities. But the Kenyatta National Hospital now boasts a new cancer unit complete with the latest technology.
It is the current generation, the current state-of-the-art equipment for cancer therapy. It also comes with a very high level of precision and accuracy. We do expect this machine to handle about 50 to 60 patients a day. The older machines also handle a similar number.
The unit will be treating its first patient in the next week. A study by the Institute of Economic Affairs predicts that by the year 2026, the cancer death rate will have doubled from 33 to 64 cancer deaths per 100,000 people. Now, doctors recommend that early detection is the best prevention, and frequent screening tests such as this one at the Kenyatta National Hospital are recommended. Michelle Ngele, KTN News, Nairobi.